After a rhinoplasty operation, so a rhinoplasty operation takes me anything from 2 hours to 6 hours, depending on what we're doing, whether we need grafts, whether it's a revision or whether it's a primary. So I can basically, during the assessment process, be able to let you know or discuss with you the steps we need to do in your case and give you a pretty accurate time as to what it would be in theatre. And most shape-changing total rhinoplasties would be of the order of 3 hours of surgical time or 3 to 3.5 in the operating theatre using an open approach. Revision cases or cases where we need grafts from other sites of the body, such as the ear or ribs, are more complex and take more time. At the end of the operation, everything's full of local anaesthetic. So the septum and the sidewalls, splints are put in on the inside of the nose, and these are plastic. I never pack noses, but the splints are slippery and silastic, so they come out painlessly. Then there's a thermoplastic splint, so it's basically a little triangle of plastic that goes into boiling water and becomes malleable and soft, and then I mould that to the nose on the outside. So at the end of the operation, you've got an external splint with a little tape on it, you've got internal splints that hold everything in position, and that's all you've got. You've got a couple of stitches under here that'll need to come out, internal stitches that dissolve, and that's it. You wake up pretty much painlessly because the face should be quite numb and the nose should be quite numb, and the local anaesthetic that's put in lasts for 12 to 24 hours. When it wears off, usually rhinoplasty is not a terribly painful thing. It's like having a really bad cold. You feel really stuffy and it's tender to touch, but people don't really come back after rhinoplasty and say it was terribly painful. It's rare to see that. If in fact it is really painful, I want you to ring me post-op and tell me. It might mean the splint's too tight or there's something else going on and I want to see you. Most people need strong painkillers for a day or maybe 2, but after that Panadol and Nurofen and those types of things are plenty. The recovery from rhinoplasty is really more of a social thing than a medical thing in some respects, because you've got obvious facial bruising and you've had a rhinoplasty. So the first week to 2 weeks, the surgery is visible. The splints are on for about a week, and after that, for the next few days, then everything's pretty new looking. From about 2 weeks onward, bruising should largely be gone. Your nose will feel like it's not yours because the whole thing's numb and it'll take months for the feeling to come back. But you'll begin to feel more comfortable and it will look kind of fat. You'll see the new shape, but it won't look fine because it'll be swollen. And that swollen's apparent to you, but probably not to other people so much. So from about 2 weeks on, depending on your personality and what you do, people start getting out and about around that time. Some people tell the world and they're out and about 2 days after the operation, but most people are not and want to keep it personal to an extent. And if that's you, then you'll be about 2 weeks before you're getting out and about. The rest of it is gradual recovery from stuffiness and watching the swelling go down. And it can take a year or 2 years or even longer for really thick-skinned noses for all the swelling to go. It isn't noticeable to others, but you'll be aware of it. You'll know that sometimes your nose feels fatter than others and feels tighter than others, and it's just a variation in swelling in the early part of the post-op phase. But I'll see you as a patient for at least a year after a rhinoplasty to make sure that that's all is well. And while you can see the new shape, really within a couple of weeks after the rhinoplasty, it won't look fine. It'll take time for that to emerge. So some degree of patience is required.